Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach healthcare. We explore breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. This episode of the Prime Health Podcast is brought to you by Grow Solutions. At Grow Solutions, we help healthcare professionals in practice or in the health tech industry who are struggling with the lack of consistent new patients, technology overwhelm, or operational inefficiencies. We help them by implementing practice frameworks that help them grow, scale, and increase revenue with AI-driven solutions. If this sounds like you or someone you know, just drop the word grow in the comments below or reach out to me on LinkedIn. We'd love to be able to help. But let's dive into today's episode because we've got a very special guest. I'm pleased to introduce you to Dr. Khoshal, a board-certified emergency medicine physician and leading expert in regenerative medicine and longevity medicine. Dr. K is the founder of Rocky Mountain Regenerative Medicine in Boulder, Colorado, where they specialize in stem cell therapy, peptides, and true disease prevention. With over 17 years in medicine and 8 years focused on regenerative therapies, Dr. K has helped hundreds of patients recover from injuries without surgery. He's also helped high performers from athletes to CEOs stay sharp and focused while into their chronological years. He's also a sought-after speaker, promoting wellness and longevity at corporate events, on podcasts, and around his community. Dr. K has published stem cell research in peer-reviewed journals, and he still makes time to get after his own health and spend time with his family. So I want to welcome you, Dr. K, to the Prime Health Podcast.
Thank you so much. Thanks for having me.
You're welcome, sir. So from your bio and the research I've done, you're very passionate about your work. Was there a specific incident that happened that pushed you into medicine?
I don't know if it was a specific incident, but it was sort of a snowball effect. I was in emergency medicine, working in a hospital setting, and, I really prided myself on being able to evaluate and treat a high volume of patients within a short period of time, staying after work, after my shift was over. And after a few years of doing that, I was starting to get burned out, which was highly discouraging. I certainly looked at some of my peers who had been doing this for decades. And, I was a little envious looking at them, like, how did they last as long as they did? And I found that there was this disconnect between how I envisioned my career going when I was in medical school, even before that, when I was in undergrad, and where I actually was. And that disconnect had to do with progressively getting further and further away from patients. And what I mean by that is I would see really sick patients in extremis, in the emergency setting. I would treat them, I would discharge them, and then a few months later, I would see the same patient bounce back. And it was really defeating to know that I probably wasn't making a meaningful long-term difference in their lives. And it came down to being highly restricted in how I was practicing. And there's a lot of things wrong with the American healthcare system that I don't need to detail here. But essentially what it was doing for me as a person who was boots on the ground is that it was driving a wedge between what I wanted to do for my patients medically and what I was able to do because of what the insurance company was agreeing to pay for. And it tied my hands and it tied the hands of the patient. And it was really defeating to come to the realization that I was really restricted in how I was practicing medicine. And ultimately, I wasn't making a meaningful difference in the lives of my patients the way that I wanted to. So that fulfillment factor was really important. And it wasn't something that was a gratifying career to the extent that I had envisioned when I was, a young medical student. And the patients were also dissatisfied in that sphere of medicine. I mean, some of my patients had been waiting in the waiting room for 6 hours, believe it or not, in the emergency room before they ever got to talk to me, to a physician, to a provider. And so they were dissatisfied. I was dissatisfied. And so I sort of stepped back and asked myself the question, is this something that I want to pursue for the next several decades, and just sort of turn a blind eye to what I was seeing? Or was I in a position that to actually make a difference in terms of where I wanted my career trajectory to be going? And so the thing that I had initially looked at as a weakness, me being young, having to do this for another several decades, ultimately became a source of strength, because I was in a position to actually do something to change the trajectory of my career, which some of my colleagues couldn't say the same, because they were really down that road. So it really pushed me to get out of medicine, start my own clinic. And then I sort of wrote down a list of what I wanted to do in that clinic. So for instance, something that was not fulfilling for me was spending 5 minutes with a patient and then spending 10 minutes documenting, what I did. The patients didn't like that. I didn't find it very gratifying. So when I started my clinic, I wanted to actually sit down with my patients for 90 minutes at a time. And I was never going to ask them, hey, time is up, you need to leave, or say something similar, but more politely. I wanted to make sure that I answered all of their questions. I wanted to make sure that I had enough time to send them a follow-up email. So that way, several months thereafter, after our meeting, once they forget everything, they could fall back on that email and basically just recaps our treatment plan or our diagnostic plan, or they could share it with their loved one. So when their spouse asked them, hey, what did the doctor talk about? I didn't want them to say, well, they said all my labs were normal and keep taking your medication or something like that. I wanted them to have like something tangible in their hand that they could share with their loved one. And, I wanted to take pride when I'm picking up my kids or dropping off my kids at school. I wanted to run into some of these parents and some of these kids where I knew that I had something to do, something constructive to contribute to their family life. And so I think I'm in a much better position now at Rocky Mountain Regenerative Medicine than where I started in the quote unquote traditional medical environment. And so I know that's a long-winded answer to your question, but that's how I sort of transitioned away from the hospital medicine and more into the type of medicine that I wanted to practice.
Yeah. There's nothing wrong with making profits, but profits in healthcare and medicine are difficult. And you turn that profit center component from the hospital arena to your own. And it sounds like it's led with passion and integrity versus the profit. The profit comes when you take good care of people, which it sounds like you do.
Yeah, I mean, I've been really lucky to build a team around me, all of whom have a background in conventional medicine. So all of our nurses, they're from emergency medicine settings. Our nurse practitioner, she comes from a background in emergency medicine. We're in the process of hiring another provider who similarly has a background in orthopedics and hospital medicine. So we're very familiar with that brand of medicine. And we certainly know, the business side of medicine, but also the medical side of medicine. And we're all on the same page. We say, like, if you build a really good product, then people are going to love it. And you could look at, countless examples of that in the business sphere where maybe a company doesn't really advertise because they don't have to. Their product speaks for itself and word spreads through word of mouth. And that's what we rely on, to be honest with you. We deliver a good product, a good service. We get a lot of fulfillment out of it, as I've been preaching. And so it's for selfish reasons also is, you get one life to live. Certainly, making a comfortable living is one component, but it's just one component. And ultimately, in my opinion, it's a small component. You want to live a meaningful life with the people that you love. You want to preach that to other people from a place of true belief in that sentiment, not just, a slogan. And I'm really, really lucky, really fortunate to be working alongside others, in our office that share that sentiment.
Yeah, I love it. Again, it's truly passion, integrity driven. So when you have a patient that comes to you from the hospital or from a typical orthopedic office and they may have knee pain or shoulder pain, how do you essentially explain to them how your practice is different?
Yeah, that's a really good question. When we first started, one of the things that I was really big on was stem cell therapy. And the reason that I say that is that these cells, in study after study, have been demonstrated to be a cornerstone of healing and regeneration in the body. And what's more is that their numbers decline as we get older. So it made sense to me to take these cells and replicate them and store them and then deploy them back into that same individual, be it for hip pain, shoulder pain, knee pain, intravenously, et cetera, et cetera. So that made a lot of sense to me. But the next question comes up is, the biology that you are reintroducing these cells to. How do you optimize that? In other words, if a patient is a diabetic, they have cardiovascular disease, liver disease, kidney disease, et cetera, et cetera. To me, it doesn't make sense to reintroduce these cells in really high numbers and sort of cross your fingers and hope that they work. It makes a lot more sense to optimize their biology. And so when I get these patients with various types of orthopedic aches and pains, I go a step further and say, look, regardless of whether we work together, regardless of whether we deploy stem cells or you ultimately decide to undergo surgical intervention, you're going to be in a much better position for recovery, for success in general, with regards to that therapeutic intervention, if your biology is optimized. Yeah. And so I think it makes sense to test some of the biomarkers that pertain to various diseases in this country that account for a large proportion of morbidity and mortality, and really check those boxes and make sure that we're optimizing your biology, we're improving those biomarkers, we're tracking it over time. And a lot of times, you don't sell a procedure, because that's not my job. My job is to recommend a procedure that has a high likelihood of success in that individual. But you can't turn a blind eye to their biology and say, hey, I'm just going to work on the knee here and forget everything else. You can't forget everything else. You need to look at everything else and optimize that. And, nothing against orthopedic surgeons, but if you go to an orthopedic surgeon, they're just going to focus on the primary problem that you're presenting with. Everything else, whether it's elective or not, they sort of turn a blind eye to it. They assume that the medical side of things is being managed by another provider. Coming from an emergency room background, you have to be well-rounded. You can't just have a focus in orthopedics and turn a blind eye to everything else. And so that was one of my other sort of strengths. One of my strong points is that I knew quite a bit about a number of different fields of medicine. And you could borrow from those other fields and really start to move these biomarkers in a positive direction. So that's how we approach, orthopedic complaints, not just as that orthopedic issue, but more broader than that. And then finally, I'll say that we work with physical therapists who are very, very good. We work with body workers who are very, very good. And they certainly have an understanding of human physiology that is beyond my scope. So there's been plenty of instances where, a patient presents with a pain in their hip and their knee. I order an MRI and it shows a certain injury, but maybe the description of what they're describing, their injury and their symptoms, doesn't quite align radiographically with what I see on the MRI. So I consult a physical therapist, I send them the MRI results, and I said, hey, here's this patient. Not everything is adding up. Would you mind working with this patient and see what else might be going on? And it turns out that they have a posture issue. Again, that's out of my scope. I wouldn't have noticed it. And it's just a matter of working with other providers in other fields that you trust and sending these patients over to them, and they work on a different part of the body, or they tell me, hey, maybe you should image this other part of the body because I suspect that it's a posture issues, and this is a consequence of another root problem. And then we image it, and sure enough, they have pathology elsewhere. And you have a discussion with that patient and say, let's address this a little bit differently than maybe what you had envisioned. And a lot of times, like, that really pays off. So that's how we approach orthopedics.
Okay. Yeah, as we spoke earlier before the podcast started, working with an orthopedic surgeon, there's a difference of owning a toolbox and owning a tool chest. You approach it from the tool chest perspective, like I've got 7 drawers to open up or more, and I'm going to analyze you each way. So does this mean, Dr. K, that when somebody comes in, let's just say for, a knee issue or again, a shoulder issue, if you're going to do stem cells with them, are you going to get them better from a functional internal biology component first before you withdraw them, or you'll withdraw and then work on the internal body?
I'll have a discussion with them. Some of my patients, it just like a lot of providers out there, me included, we require a paradigm shift. You can say the same about about patients. We're all human, right? So I'll have this discussion with a patient. Like, look, this is how I approach your specific complaint. I really approach it holistically. This is what I recommend. But ultimately, the decision is theirs. And a lot of times they have another doctor that they've been working with for decades sometimes. And maybe they're even like a family friend. And they'll say, you know what, doc, my other providers have the other bases covered. I don't need you to look under every rock. I just need you to do XYZ because one of my friends came to you and they had positive results. And I just want you to focus on the knee. And I've done my own research with regards to stem cell therapy or PRP or peptides. And I just want to cut to the chase. And so, I'll have this discussion with the patient. And so that way the seed is planted and they know that I certainly go beyond just giving them a peptide or instituting stem cell therapy or what have you. I'll do this, but just know that there's this whole other story that to me at least remains untold. And some of them will come in and they'll maybe give me labs a few weeks later, like, hey, I thought more about what you had said, and I just kind of want to bring in these labs for you to review. And so this, it's sort of an ongoing process. It's probably not in everybody, at least. A change in a paradigm shift is not going to happen with just one discussion, but you build trust. And so if they really want to do like stem cell therapy, if they really want to do peptides, as long as they know my vantage point, my perspective on things, ultimately it's their decision. And a lot of times what happens is that you fix their knee problem, you address their shoulder problem, and a few months thereafter, they'll come back in and they'll share stuff that you never thought or you don't think is pertinent, but they'll share all that stuff just in case because they trust you so much now. So, everybody's a little bit different. You just got to individualize, tailor your approach to, where the patient's at and meet them where they're at instead of trying to convince them of your philosophy.
Yeah, I think that's a great point. Again, it comes down to you had a paradigm shift, as you said, in your life. You're talking about patients needing that. Many patients want a quick fix. My knee hurts, fix it today. I'll come back in a month when it does, but you can't do that. You have to educate them on it's a slow process. We can work on it quickly, but the better benefit is if we work together to optimize your health before we do this next step.
Right.
We can win both ways, but the longer lasting step is if you give us a little bit more time in the process. And that's not always an easy situation.
Right. And so it's an ongoing dialogue because those are the same patients who will, go under the knife. They'll go meet with an orthopedic surgeon. They're not going to go for a second opinion to another orthopedic surgeon. And if that ortho surgeon recommends a knee replacement, oftentimes kind of the default thinking for the patient is that then I'm set for life, right? I can go back and hike the Grand Canyon and I can go, skiing. And it turns out like, no, like a lot of times there's not like simple answers. There's pros and there's cons. And, in this country, I think there was certainly a time, I've worked with plenty of orthopedic surgeons. There was a time when like those types of surgeries were really taken seriously, and there was a deep discussion that was had with the patient, and the surgeons were really selective about who required that type of surgery because the long-term consequences were taken into account. And these days, to some extent, unfortunately, in medicine, those those types of surgeries have really become commonplace. It's not unusual for a patient to say, hey, the first time I met the anesthesiologist, the guy who's going to sedate me and put a tube down my throat and put me on a ventilator, the first time I met him was like 30 minutes before surgery, which is crazy to think about, because
laying on the bed,
not everybody comes out of anesthesia. And to meet your doctor who's going to be doing that 30 minutes before surgery, it's a little crazy to kind of fathom, or, hey, I went to my doctor's office, but I didn't get to meet the guy who's going to be doing my knee replacement. I met like the assistant to that surgeon. And, but the first time I'm going to meet the surgeon was when I'm under anesthesia.
Yeah.
And I think we need to take these types of surgeries serious. They certainly have good outcomes. It's changed a lot of lives for the better, but let's not be so quick on the draw. I've got patients who are in their 40s, and now it's several years post injection of their knees with stem cells, and they're doing far better than when I initially saw them several years ago. But when I first met them, I specifically remember it was around COVID, the couple of patients who I'm thinking about, they're both in their 40s, unrelated to one another. They had plain films, just plain x-rays of their shoulders, reviewed by an orthopedic surgeon. These are different orthopedic surgeons in different groups. They were reviewed on a platform like this, like this screen share kind of thing. And they were told you need bilateral knee replacements, which is a little crazy to recommend that to someone in their 40s, knowing that the average lifespan of these surgeries, of these replacements, is about a decade. And you're going to be looking at another surgery and another surgery and another surgery over the course of your lifespan. And that's not even to say, like, you're going to have a bunch of metal and foreign material in your body that are going to be leaching stuff that you're not even going to be aware of. Like, we can't even test for some of this stuff. Yeah. And so that's just a lot of trust and a lot of cons that haven't really been explained to the patient fully. So, you run into patients whose understanding of the medical system and alternatives is only skin deep. It's very superficial. And so, again, you have to meet these patients where they are, explain to them what I do, how that differs from conventional medicine, what kind of implications that has for their long-term health. And then ultimately it's their decision, once you explain that to them. So,
yeah. So let's jump to asking maybe a specific question about some of the services that you do, Dr. K. And what I mean by that is, same knee patient comes in and they said, well, I've got some choices, and that choice is I can go back to my orthopedic surgeon and get a shot of Synvisc. Okay. Or I can come into you and get PRP, or I can come into you and get stem cells. How do you differentiate? How would you educate me on saying, I think this is where PRP fits for you, or this is where stem cell would fit for you?
That's a really good question. The way that I would explain it is there's a difference between what I refer to as biological therapy, and that includes peptides, for example, that includes PRP, that includes stem cell therapy, and treatments that are not quite biologic, which includes steroid injections or hyaluronic acid or surgery. And when we institute biological changes, these cells, let's start with stem cells. These cells are alive. They're responsive to chemical signals of injury that are emanating, that are released from cells that are injured in different parts of your body, including the knee. So these are like smart bombs where they, just because you inject them into somebody's knee and something that wasn't even visualized on the MRI, which is the best imaging modality that we have, if those cells that are injured, that are not being elucidated on that MRI scan, if they're releasing these chemical signals of injury, calling for help, these smoke signals, calling for attention, the stem cells will preferentially gravitate towards those nodes of injury. And once they arrive, there's a dialogue that happens at a cellular level between the stem cell and the injured cell. And one of the tasks for the stem cell is to determine if that cell that's injured is salvageable. And if it is salvageable, then what does it require? What does it need in terms of proteins, in terms of RNA, the coating material for proteins, to be nursed back to health. And if it can't be nursed back to health, then it's the job of the stem cell to basically tell that cell to kill itself, to undergo a process called apoptosis. And it may sound a little counterintuitive, but we don't want unhealthy cells just kind of hanging out and being, a drain on the biology as a whole. So you want that cell to undergo apoptosis and weed itself out of the gene pool so other healthy cells can take its place. And one of the things that really makes stem cells unique is that even though all of your cells have a copy of the same genome, half from your mom, half from your dad, the unique thing about stem cells is that they have access to a much wider swath of that genetic material compared to a more specialized cell like a muscle cell, cartilage, bone cell, or what have you. Those specialized cells only have access to those parts of the genome that pertain to their specific function. Whereas a stem cell, because it's undifferentiated for the most part, it has access to a much wider swath of that DNA. And so when it arrives on scene and it's carrying on this chemical signal dialogue, this language that they use to communicate with one another, if it figures out, hey, it needs this injured cell requires this particular protein, I'm going to furnish it with this genetic material so it can start manufacturing that protein in order to be nursed back to health. And how does this particular cell fit in with the general tissue that it's embedded in? What do the other cells require? How do we nurse this entire tissue back to health? These are like levels of thinking, if you will, if you want to call it that stem cells have access to, that a medication like steroids simply doesn't have access to. When you inject steroids into somebody's knee, you're curtailing the amount of inflammation that's present. Inflammation is uncomfortable. It causes pain. So if you take a steroid like prednisone orally, or you inject hydrocortisone into somebody's knee, you're just curtailing, you're stopping that inflammation. The patient feels better because the pain is gone. But long term, there's no meaningful repair that's happening. There's no regeneration. There's no dialogue that occurs. The other thing about stem cells is that they can undergo something called asymmetric replication. In other words, whereas most specialized cells, when they divide, one parent cell becomes two daughter cells, and the daughter cells are carbon copies of the parent cell. The unique thing about stem cells with this asymmetric replication is that one cell can become two cells, but one of those daughter cells is not a carbon copy of the parent cell. That daughter cell has taken cues from its surrounding environment, it's responded to the chemical signals, and it's shifted, it's restricted the genes that it has access to. And by virtue of that, it's become a cartilage cell, or it's become a bone cell. And so it can do that to fill in that void. So by those two mechanisms, namely stem cells talking to the injured cell and furnishing it with the genetic material to produce proteins to nurse itself back to health. And then secondly, through asymmetric replication, stem cells can nurse that tissue back to health. And you can't say that, like I said, about hyaluronic acid. Yeah. Hyaluronic acid, for your viewers and your listeners, is essentially, think of it as motor oil that's being put into gears that are kind of rusted. Ultimately, it's not really doing anything for the rust. It's kind of temporary. It allows those gears to slide past each other and fit into each other and make less noise, but it's temporary. And once its effect wears off, which typically occurs at the 3 to 6 month mark, nothing's really changed. You're back in the same rusted gears. Yeah. The idea behind stem cell therapy is to go in and think of them as, keeping with that gear analogy, as little mechanics that are going in to address the root problem. And, these are the types of, interventions that make doctors like me seem really smart, because truly I didn't do anything, right? Like, I wasn't in there scraping away tissue, removing tissue. I just injected your own cells that you didn't have very many of to begin with. And they're now culture expanded, they're replicated, so they're really high in number. I simply reintroduce them back into the site of injury, and I let them do what they do, and that's it. So that's kind of the difference between biological interventions and these more, sterile, synthetic, if you will, interventions.
Yeah, they're cover-ups. They're not. They're buying you time. So are biologics. They buy you time, but they fix.
They fix.
Yeah, and the reason most people, hopefully, the physicians are telling them if they are getting a corticosteroid injection that if it's in your knee, you can do 3 in a year. We wouldn't suggest any more than that. There's a reason why they should be telling you that. Some don't all the time.
Some don't. Yeah.
Unfortunately. Yeah.
Yeah, and I've had plenty of those patients. I mean, that's another side effect of steroids is they stop inflammation, but they don't really differentiate between something called acute inflammation and chronic inflammation. And acute inflammation is part of healing, is part of regeneration. When I do stem cell therapy, I'm causing acute inflammation. And that's okay. It's supposed to occur in the short term, but not the long term. It shouldn't be inflamed years and years down the line. Well, when you inject steroids into somebody's knee, it's stopping both chronic inflammation, the bad form of inflammation, but it's also stopping acute inflammation. It doesn't really differentiate. And so again, the patient feels better in the immediate term because all inflammation is gone. The pain is much better and they're able to do what they love, but just know that it's temporary. And in a weird way, it is addictive, right? Like if you've been living with bad knees for a number of years and someone comes along and injects some magic potion in there and you feel better for 3 months, well, at the 3-month mark, are you going to go back? Probably. So it's not addicting in the same sense that opiates or benzodiazepines or alcohol is addictive. But it is addictive nonetheless, where you keep going back to the same well over and over again. And unfortunately, steroids really weaken connective tissue. There's complications like necrotic or dead bone that could result from steroid injections. There are injuries to the cartilage that can occur because the cartilage has been weakened through repetitive steroid injections. And you really can't tell if that's going to happen at injection number 2 or injection number 5. It doesn't come, pre-labeled like that. So you could be stepping on a landmine at any point in time, unfortunately.
Yeah. As Dr. K, as the medical, you're seeing a bigger shift from not getting into politics, but from the world aspect, you're seeing a bigger shift that people are trying to look for better outcomes for themselves. They are considering a second opinion. So how has patient demand for your services increased in the last year, 3 years?
That's a really good question. And, in the US, not to get too conspiratorial here, but the reality is that most research into medications is being driven by pharmaceutical companies. Mm-hmm. And I'm grateful for that to some extent, right? Like we're all familiar with medications. Maybe you take them, maybe your loved one takes them, and it does do wonders in many respects. So I'm grateful for that innovation that's there. The interesting thing is that with stem cells, which are naturally occurring, one is not able to patent them. And that makes sense. Stem cells are no one's intellectual property. So you can't say, hey, I invented stem cells and, this is how I'm going to sort of monetize it and nobody else is allowed to benefit from this technology. Luckily, we have this technology in our body. It's nobody's intellectual property. The way that fits into the system that we have in the US and the pharmaceutical, industry goes is that, when it comes time to approve therapies through the FDA, it's an arduous process. It takes billions of dollars. It takes decades of research to try to push a drug through the FDA channels in order to get it approved. And so, I do certainly hear complaints about the price of medications. And believe me, there's definitely some price gouging, going on, especially when these medications are on patent. So I completely understand that. But I also understand how much work it goes into these medications. And it's a lot. And when it comes to something that is naturally occurring, however, like stem cells, who's going to dedicate billions of dollars in research to studying stem cells and decades of work to try to push it through the FDA channels for approval if at the end of the day, it's nobody's intellectual property and you can't monetize, you can't recover those billions of dollars that you invested in it. And there are plenty of examples of drugs. Recently there was a settlement in terms of the victims of opiates during the opiate epidemic against Purdue Pharma, right? This is a pharmaceutical industry that came out with opiate after opiate, and they had their drugs go through the same channels that I was just describing, but they benefited excessively, and they pushed their drug, through really some unsavory in unsavory ways. And ultimately they profited to a great extent through that intellectual property and getting their drug approved and then selling it to the American public, knowing that it was doing a lot of harm. Yeah. But they did it because there was a way to recover all those profits, all that money that they were investing into it. Well, stem cells really don't fall into that bucket. Why? We all have them, and it's nobody's intellectual property. So if you, as a pharmaceutical company, just invest billions and billions of dollars into it, and you have no way of seeing that money come back to you, it's just not going to happen. So stem cells, unfortunately, to this day, have not been approved by the FDA for use. And, but there's ongoing debate about whether stem cells in regulating stem cell therapy falls under the purview of the FDA at all. So that's an ongoing case that is being actively litigated at the federal level, and we'll see where the dust settles. But what is undeniable is that these cells are in our bodies for a reason. And there's been experiments that have been carried out in animals where they've extracted stem cells, caused an injury to that particular animal model, and the type of healing and regeneration that occurs in the absence of stem cells leaves a lot to be desired. It's not meaningful repair. It's not meaningful regeneration. And then when you reintroduce stem cells into the mix, sure enough, there's much better, more functional healing and regeneration that takes place. So what's not under debate is the effectiveness of stem cell therapy. Yeah. And we're being caught up in the politics of, has this been FDA approved or has it not? And I always tell patients, look, if you're looking for stem cells to be approved by the FDA, it may not happen at all. And if you are looking for that in order to undergo stem cell therapy, that's totally fine, but it's a matter of opinion. And ultimately, if you're not comfortable with any form of therapy, unless it's been approved by the FDA, then this is clearly not for you because it has not been approved by the FDA. Yeah. But I've certainly, and this is just anecdotal evidence, I've seen the benefits of stem cell therapy in my patients, as have other physicians. I go to conferences all the time and speak with orthopedic surgeons, neurosurgeons, internal medicine doctors, and they're all saying the same thing. Like, I use them in this way, I use them in this way, I use them in this way in my field of medicine. And they're all pointing towards the same conclusion. When you look at stem cell research in animals, be it mice or dogs or monkeys, they're all kind of pointing to the same conclusion, which is you need stem cells for healing and regeneration. You need a high number of them. And even with unicellular organisms, in a petri dish, stem cells can bring about a lot of healing and regeneration. So I really firmly believe in the utility of stem cells, certainly over a lot of other conventional therapies. And I say that as a medical doctor.
Mm-hmm. Yeah. Well, the truth is, I don't think we want the FDA to regulate it because they're going to try and control it then. It's not about regulation. It's more about control. So, I appreciate you sharing that information. The listeners, the viewers, it's important that they know that. From your practice perspective, Doc, since we do have some other physicians that watch this. So what have you done? I know you said that it sounds like you're very referral based, which is great. Do you have any marketing magical tricks that you do for your practice to bring patients in your door?
That's a really good question. Marketing, I didn't know until I started this clinic, just how sort of pitfall laden the whole marketing industry is. In other words, if you can market yourself as a marketer, that's basically all you need. You need to know nothing else about marketing. And so, we've certainly worked with various types of marketers, and almost universally, it really hasn't worked. I think it just takes, an introduction to someone who's been doing it for years and working with clinics specifically, whether that's chiropractic clinics or medical clinics or regenerative medicine clinics, however you want to refer to them, but you need to be working with someone who has years and years of experience of doing that to really probably for that process to bear some fruit. And so I don't have much experience in terms of working with those types of marketers, unfortunately. But what I've been really fortunate with is word of mouth. And I know that doesn't, probably answer your question satisfactorily, because, at the end of the day, back to what you said earlier, if you do what you do really well, to the best of your ability, your patients are going to know that, and they're going to tell their friends, they're going to tell their family members, and they're going to say, hey, I saw this particular provider, this particular doctor, go to them. And I hear that all the time, where somebody is traveling around to different conferences and they're kind of seeing the same folks, but maybe not on a routine basis. And, we'll have somebody from New York call us, and they'll say, hey, your patient who I hadn't seen in a while looked great. Or maybe I hadn't played, soccer with this individual for a while, and they were running around, circles around me, whereas before they couldn't do that. They were experiencing all kinds of symptoms. And I asked them, what's your secret? What's going on? And they referred me to you. So word of mouth really carries far. And I know it's very, very cliche, but at the end of the day, if you've got a really good product, if you deliver a really good service, if you're pouring your heart and soul into it and you really believe in it, word is gonna spread. I'm a firm believer that we're all connected on some level. And, I've been really fortunate to work with patients who have much bigger, megaphones and much bigger platforms than me. And word spreads, and people talk, and we get referrals constantly. Yeah. So I've kind of struck out, to be honest with you, in terms of marketing, but it is what it is. I think being an entrepreneur, being a business owner, there's some lessons that you just got to learn the hard way. But at the end of the day, if you're that entrepreneur and you think about what you do day and night, and whatever it is, it doesn't have to be in medicine. That word is going to find a way to carry away from you, and it's going to catch the attention of people wanting to seek you out.
Yeah. Great points. You kind of, it sounds like you have some limitations in the practice that's only because you're the main provider that's there. What do you feel have been the struggles in the inability, maybe it's not, but the difficulty in scaling or growing your practice?
Yeah, I'm not sure. I want to, scale. I know that typically, whether it's, and I have a lot of friends in the business industry, and, they've talked to me about it, and they've kind of brought their own experience about how they were able to scale. And that comes with, with some, setbacks also. You lose control. The product kind of dilutes itself to some extent, and so, my issue is that I'm really steeped in our practice. I'm really busy. I have 3 kids, and my measure of wealth is not necessarily, what kind of car you drive, but it really is how much time are you spending with your family, with your loved ones, with the people that you really care about? And that is ultimately, I think, a greater measure of success and wealth for me than just, than revenue. So I don't know if I want to scale. What I would like to do is to, probably bring on another provider. And, the past couple of months, we've interviewed, dozens of individuals, a lot of capable individuals out there, but I think we've got it narrowed down to who we want to hire. And so over the next few months, we're probably going to bring on another provider here at the practice. And it's a matter of training them and learning from them, and sort of going from there. But I don't think I'm sort of interested in scaling in the conventional sense where you open up several offices in different cities and sort of go from there. I don't think that's for me. I think I'm very comfortable sort of financially being where I am. I'm getting fulfillment from what I do now, which is really important because then you see longevity in what you do. I hear, friends and family talk about retirement and how they're, looking forward to it or how they're really enjoying it. I really enjoy what I do. I see it, I see myself doing it for decades to come. And it's a matter of making sure that, I'm taking care of the other important things in my life, which is, making time for friends, for family, and sort of going from there. So
sounds like your values are in the right place.
I hope so. Yeah.
I don't think you have to hope. It sure sounds like it.
Yeah.
So as AI starts to implement some things in everyday life, of course, but in medicine, if you could, hold out an AI magical wand and you kind of spread it over your practice, is there something that you wish that it could do for you from an automation aspect in your practice?
We have integrated AI to a large extent. And I think we're probably at the forefront, just sort of attending different conferences, getting to speak with other providers in other parts of the country. And, I would say we're definitely ahead of the curve when it comes to AI. And luckily, like I said, I learn a lot from my patients, and this is one of the benefits of sitting down with them for 90 minutes, because quite honestly, I learn more from them than they learn from me, I'm sure. And so some of these guys, they're really steeped in AI in whatever industry that they're using it. And then you kind of think about it and, you're like, well, what's stopping me from incorporating this into what I do? Maybe I can do this. And you start, I'm not a programmer. In fact, when I was in high school, my one programming class that I took, I hated it. I didn't know what I was doing. I don't know what grade I got, but if they passed me, which they did, I must have fooled them somehow, but I don't know what I'm doing. But, these days using Claude to program, you just basically type out what you want it to do, and it comes up with a program that you might have to alter here and there. It's huge. It's really, really helpful. Before I was really afraid of spreadsheets, and let alone having to enter formula, different formulas. And these days, my God, you just tell ChatGPT what you want it to do, and it tells you the exact formula that you should enter where, and it addresses it. It's really phenomenal. I'm really excited about where it might be going in the future, but we're already incorporating it. So.
Good. Excellent. So from a bragging standpoint, do you have, it's, of course, don't give away personal information, which I know you won't, but can you give us, maybe there was a patient that did come from a medical provider, or maybe they didn't go to a previous medical provider. They came in, to see you. Is there just this one story, this one patient outcome that's just an amazing story? I'm sure your practice is still.
Yeah. I mean, there's a lot, but I'll tell you about a patient who I just saw yesterday. And so actually she's my patient, her husband's my patient, her daughter is also my patient. But, as you were asking that question, I was thinking about them, and maybe it's just because I spoke with them yesterday. But these patients, they're in their upper 60s and 70s, the husband and wife team. And in her case, she's almost 70. she hadn't really done competitive running. She came to us several years ago with a plethora of complaints that were difficult to kind of, sort of put together. And some of it had to do with prior toxic exposure. Some of it had to do with orthopedic injuries. And in her case, because she's traveling from afar, we're sort of limited as to what kind of therapies we could do. And so we talked at length about what kind of therapy we could institute. And we ultimately did stem cell therapy. So we banked her stem cells. This is where we do a liposuction procedure here at our office. We remove some fat from their body. Then we isolate the stem cells, replicate them, like I was saying earlier, over the course of several weeks in a lab under sterile conditions, to hundreds of times the number of similar cells occurring naturally in the body. And then you freeze those cells and you start reintroducing it back into the body, maybe intravenously, maybe into a knee, hip, shoulder, et cetera, orthopedically. And we did that over several years, I think over the course of 2 to 3 years. And each time she saw incremental gains in function, and she started to feel better, and we started to tweak her hormones. This is a woman who is postmenopausal, and she was experiencing a number of symptoms. And if you do an online search, there's tons of like crystal waving, as far as how to deal with menopause. And ultimately, the way you deal with menopause is introduce back into the body what these women are lacking. We don't need to come up with, the pixie dust and whatever else. It's not complicated, but it's a multi-billion-dollar industry of supplements and whatnot that supposedly addresses menopause and the symptoms that are associated with it. But we put her on a few supplements, certainly, but we put her on hormone replacement therapy. And now she's entering races. She's winning races. She's on the verge of entering the Senior Olympics. And I have no doubt that she's gonna medal. She's gonna win a gold medal in her age group in the Senior Olympics. And this is somebody who hadn't run, and she hasn't hit peak yet, is the crazy thing. The older she gets, her running times are actually getting better and better, and they're better than mine. And I'm not a runner. I actually hate running, but ultimately she's doing better than I am. And I'm kind of lucky that she's out of state and I don't have to run with her, because I have no doubt, like, imagine being beaten by a 70-year-old, in running. And it's like, it gives me a little bit of inspiration, to be honest with you, because I look at her, I'm like, well, I hate running, but she hated running too. And look at her, like, maybe I can do what she does. And her husband's, an even better runner than she is. But he was always, a runner. So to me, it's less inspiring, but her story is really inspiring. But we've got tons of stories like that where, at our clinic, we also see kids with cerebral palsy. And if you're not familiar with that, or your listeners aren't, then that's where there's an event, usually in utero, during pregnancy, when there is a lack of oxygen being delivered to the central nervous system, primarily the brain. And these kids sustain neurologic injury as a consequence of that. And the symptoms can be really, really mild, where, function is preserved, and on a day-to-day basis, you're probably not going to know that there are any limitations in someone's capabilities, but the symptoms can be really severe, just depending on to the extent to which the brain has been damaged. And so some of these kids, we saw our first patient with cerebral palsy about 7 or 8 years ago. We saw our first patient with autism about 8 years ago, where we deployed stem cells. And again, I don't want to keep talking about stem cell because there's a number of other forms of therapies that we do, but this is what we offered to them. There was, they posted it on different online groups that the parents were a part of for moral support. And they posted, how the kid was doing previously with respect to their vision, their hearing, their fine motor skills, gross motor skills, their language, et cetera, et cetera. And they posted their post-treatment results. And it was night and day. It was pretty remarkable.
Wow.
And, we were just inundated with patients seeking similar therapy, to the point where like we really had to screen, because at that time, we didn't feel comfortable treating pediatrics, not because we didn't have the medical ability to, but it was a little bit of a moral sort of conundrum, because stem cells hadn't been studied extensively in that age group. This was an age group that really couldn't provide consent to us. And so, we would consult their pediatrician, their neurologist, and some of these doctors were really receptive, and they would say, like, we're at the end of what we can offer.
Why
So
not?
anything that you can offer that's safe, that's, even if it's investigational, if the parent is okay with it, who are we to say no?
Right.
And whereas other doctors were, they kind of dug in their heels, and but it was, we had to explain to them, this is your personal preference. Like, there's nothing that's been documented that paints stem cells in a bad light in the current clinical circumstance. So it certainly applies. Just understand that this is your personal preference. But ultimately, if you don't want me to do this procedure, I won't. This is your patient. But a lot of those parents would be a little upset, and they would say, who's this doctor to say that? Like, we saw this neurologist one time, and they're making that sort of a conclusion for, on behalf of our kids.
Yeah.
And so they would bring their kid, we would do the therapy, and they're still our patients. I mean, patients who we saw 8 years ago continue to come back, every 6 months or every year for deployment of their stem cells back into the body. Just yesterday, we had, a kid fly in from Canada, and we saw that kid. I think we've been seeing him for about a year now. And this is a kid who was, the parents were told that he would never recover gross motor function, that he would not have recovery in terms of certainly language. There would be no way for this kid to communicate. Now, it's been, several months since their last treatment. They just came in for the second one yesterday. And the kid, when we first saw him, when we put a needle in, the kid wouldn't react. And yesterday, I'm in here while the nurse is, placing the IV, and the kid just, starts hollering and starts crying. And it was a good sound because clearly, like, they're a far cry, literally, from where they were the last time. And the kid is now able to communicate, able to talk with his parents. He's able to use a walker, to get around. I mean, it's crazy. And you ask a neurologist who's been seeing kids like this for a number of years, what sort of result did you expect in somebody with cerebral palsy who you saw, a couple of years ago, and they were in this condition? What kind of recovery did you anticipate? And they all tell you, look, the only thing we have to offer is speech therapy, occupational therapy, physical therapy, maybe vision therapy, but that's it. And they don't have anything else to offer. And that's not, I'm not trying to denigrate specialty. I have so much respect for neurologists and pediatric neurologists. The point I'm trying to make, in conventional medicine, there's a ceiling. There are limitations that you come up against. And if there's a parent who has a kid with autism, with cerebral palsy, with brain injury, we have a patient who was on the verge of going to college on a football scholarship, who sustained a skateboarding accident just after graduating high school. And he was admitted to UCSD, their hospital system, and he was given a horrible prognosis that this kid would not be functional, not be, like, you'll be lucky if this kid survives his hospital stay, that he's probably going to pass away, in the ICU. And this kid, I saw him after several rounds of stem cell therapy. The last time that I saw him was probably about 6 months ago. He walked in with his mom, and he's holding a Starbucks coffee. I'm waiting for him at the front door. And so when I saw him, we have huge glass windows. You can, look outside onto the street. I saw somebody walking by with a Starbucks coffee in their hand, and I didn't recognize him. And so I kind of looked past him, and he turns the corner and is coming towards me. And I'm like, oh my God, like, this is really remarkable. And I think he's undergone 3 or 4 rounds of stem cell therapy. He's still in a place where he's going to be dependent on his parents for activities of daily living, but like he's on the verge of living, in an apartment where somebody checks in on him pretty routinely. And it's just been a few years now. And this is someone with a really bad prognosis. So when you say, like, look, do you believe in stem cell therapy, or why are you so passionate about stem cell therapy? That's why, because it's the type of therapy that unfortunately isn't getting the kind of press that it really deserves. Yeah. And it really helps to be on a podcast like this, or for, Joe Rogan to be talking about somebody doing stem cell therapy and what kind of results they're getting. Because at the very least, I totally understand it's all anecdotal. It's all anecdotal, but at least it's getting the word out, and it encourages, whether it's parents or patients, to do some research outside of conventional medicine, because there is a limit to conventional medicine. There is a ceiling. And again, I say that as a medical doctor. I'm not trying to denigrate that field. There's a lot of good that's come from modern medicine. I completely admit that, but there are limitations, natural limitations to that brand of medicine, that I think if you're hitting that ceiling, if you're hitting those limits, it would behoove you to look outside of that at regenerative medicine.
Yeah, absolutely agree. And what people have to understand, which I think you're expressing, is there are, it's internal hope. It's the way the body has an innate ability to heal. You have to give it that opportunity, and using their own stem cells that understand, and as you replicate them and give them more back, it gives them a chance that they didn't have. So hope shouldn't be the only medicine, but if others aren't working and you've hit that ceiling, why not try it? It's such an unfortunate thing where people don't think to let it happen. Investigational or not, there's too many practice case studies of positive results. You wouldn't be as busy if it wasn't working. People wouldn't return if it wasn't working. It's a testament to what's happening, and to you and your staff as well.
Well, thank you.
Yeah. You bet, Dr. K. So I want to ask you, how can people, if they're interested in what they saw here, how can they get a hold of you? How would you like them to reach you? And I'll put some of your contact information in the show notes as well, but how can they reach out?
Yeah, I appreciate that. Yeah, our clinic URL is rmrmco.com. And RMRM is the acronym for our practice, Rocky Mountain Regenerative Medicine, and CO, like Colorado, the abbreviation for our state. So it's rmrmco.com. And then we're on TikTok and Instagram and Facebook. And so, yeah, you'll include that in the show notes.
Yeah, so. Absolutely. Well, as I wrap this up, Dr. K, I appreciate it. Every time I do these, I learn. And I learned a tremendous amount about you. Like when we first came on, I told you you're a very handsome young fella. But the intelligence and truly the passion and the care and the integrity that you have for your patients, it sees through. And we need more of you that are out there. We need more people like you that care, that want to push the envelope on healthcare. So I appreciate you sharing your expertise with us. It's your unique perspective that allows others to think, that says, I've heard about stem cells. I've heard about peptides. Why don't I call this office? Why don't I look them up for an opportunity? So again, I appreciate that from, your perspective, what you're doing. So for the people that are listening to this, if you found today's conversation valuable, please subscribe to the Prime Health Podcast on your favorite platform. If you're watching on YouTube, hit that bell so you get notifications when the new ones come out. If you think this would be helpful for others, please share it to them as well. It's really important that Dr. K gets his message out. So until next time, stay at the forefront of your wellness journey. And for practitioner friends that we all have in common, remember the best time to optimize both your practice and your personal longevity is right now. Again, Dr. K, thank you very much for your time today.
Thank you very much for having me.